Here we go. Hi, everyone. I am Leslyn Keith. I'm the president of the board of directors and the director of research for the Lipedema project. And I'm here with my friends and colleagues. I have Siobhan Huggins, who is our research specialist. Hi, Siobhan.
Hello.
And I'm also here with Gail Straker. Here's our community manager and kind of all around gal of all trades, kind of does everything.
Well, thank you. I don't know that I'm a jack of all trades, but master at none, except probably talking. And I'm speechless today. So what can I say?
You are so funny. But I have to say also another thing that all three of us have in common is that we are carnivores. So we enjoy animal source foods. But that is not the main topic of today, although we all have that in common. What we do love to get together and talk about with you is what's new and coming up with lipedema. And so we have a couple of really interesting things to talk about today. The first one that I was going to talk about is that we're so excited that our coaching special interest group, our CSIG, will be starting on Monday. And I think that both Siobhan and Gail, you're going to be there, right?
Right.
Yep.
Yeah. This one is specifically looking at comprehensive and creative physical management strategies for lipedema. And so we're going to be looking at manual therapies, all kinds of things you do with your hands and how you help your skin and your tissues. We're going to be talking about compression therapy. Everybody asks, what should I be wearing for compression garments? How strong should it be? What body parts should I cover? What should I get? And that compression session is also going to talk about pumps. Oh boy, people always have questions about pumps. So that's going to be a great session. We're also going to be focusing on skincare, which is super important for everybody, but really for lipedema. And then we have another session just to focus on vibration and all those other great complementary treatments you could do for yourself for lipedema. So if you've ever wanted to take a deeper dive into how to manage your lipedema, how to live your best life and really control your symptoms, this is going to be a nice course for you. It's all offered virtually. We're going to have group coaching as part of it as well, and also access to our community. So you'll have access to the recordings and the community for 6 months after the course is over. It's going to be happening on Mondays for the month of August. So starting this Monday. So we will post a link to sign up if you would like to sign up. Or also, I think Akanksha will also post a link to the replay of a webinar that we had earlier this week that gives you all the information about the CSIG, more than I can tell you on our little thing right here. Yes, it's being posted right now as we speak. So go ahead.
Yeah, I'm really looking forward to it because while I have gone into compression and played with that a little bit, I don't actually know that much about other therapies. And for me, like, I want to know for myself, but also because I talk to other people, doctors, and just people with lipedema a lot, and I want to be able to actually know what I'm talking about. So I'll look forward to that. Yeah, and it'll be interesting. Because even in that little webinar, there was so much covered, and it's like, okay, now I want to spend time on each of these so I can actually understand them a lot better, and then kind of figure out, like, does this kind of apply to me or does it not apply to me? Is it something I want to try? And just get a lot more details, so that'll be fun.
Yeah, I've seen what you've done so far, Siobhan, in your work is that you're really trying to focus on, well, how does lipedema start? How does it evolve? What's actually happening in the tissues? You're looking at all of that stuff. But as far as just those strategies. Well, how do I manage it in the meantime while I'm researching all this other stuff? How do I
Well,
manage
not only that, but as I learn more about how lipedema works and how it may be starting, it does lend itself into now learning more about different therapies, because it's like, oh, this will treat this thing that's happening. This will treat this thing that's happening. And so it's kind of a natural progression of the research is, okay, now I've kind of figured out how I feel about it to an extent. Let's move on to why the different things we're using can work and how they may apply in different situations of people, because every therapy is not going to be for every person.
Exactly.
And the more we learn about how the therapies interact with lipedema, the better we'll be able to tell people, oh, you're in this kind of situation, maybe you should try this type of thing.
Right.
And there's probably a lot of that already going on, but I just want to become better acquainted with it because I like learning stuff.
Sometimes you don't even know what options are out there. So how would you even know what to ask about, what to choose? Gail?
And what I find as community manager is people constantly come to me asking questions here, and either in Facebook or Circle or just emails. We're constantly getting questions. What can I do? What can I do? What can I do? And I find that, yes, that, eating a different way, like keto, carnivore, super low carb, can help, but you can't get results like that. I mean, you might have to wait a few weeks, right, before you realize, oh, my pain isn't so much. Haven't lost any weight, but I don't have as much pain. But when you're using something physical that you can do every single day from your own home, for example, a vibration plate or self-manual lymph drainage or something, you're in charge of that right then. But if you don't know what's out there, or if there's just so many options out there like there are, you don't know how to tune in and get what you particularly need. And so what I find actually from like your webinar is that we were learning, oh, this is something I can do for free, right? I mean, you got your hand on the end of your arm and you can learn some self massage techniques, right? Or maybe all I need to do is check my lotion to make sure it's a good lotion and use it. So these techniques that you're going to dive in deeper with in the CSIG, and the availability of having coaches to talk to one-on-one, I think is vital for all of us to be able to do that. The connection with the other members in the group, what are they doing and how do they do it every day? Because it seems like with lipedema, it's all encompassing. I mean, it's not, no, that's not the right word. It just kind of takes over our lives, right? And so to make it a simple routine every day and get all those questions answered is just going to be so valuable for all of our community members.
I think, that people can become easily overwhelmed by it. And so when we start saying, there are options, there are possible solutions, there are things for you to look at, to discuss with your healthcare provider, to thank you, Kasser, for your comment. So there are things you can do, and there are ways you can take control, that you can be the one making the decisions, and not just at the mercy of lipedema. I do want to make it clear that when we do this course, we're going to be looking at all types of different physical management strategies. You're not going to learn how to actually perform these on yourself, but you will have the resources to then find someone who could teach you, because it really is a very individual thing. Not everybody is going to perform self-manual lymph drainage the same way on them. And in this course with a group of people, we cannot be making sure that each individual in the course is going to be doing it specifically the way they need to do it. And but by you learning about these physical management strategies, now you can go to your lymphedema therapist, which we will help you find, and then talk with them about, is this going to be something good for me? Should I try myofascial release? Should I be using vibration? What do you think about a pump for me? Because now I've learned about how pumps can benefit lipedema. And so you will know what your options are, and then you will be able to pursue those with your healthcare provider or your lymphatic therapist. So you will have the tools that you need to be able to pursue these things by being in this course. So we really look forward to it. Kim says, thanks for being here, Kim. You're all such a great resource for others trying to learn if they have lipedema initially, but if so, you have all the bases covered with self-care and support systems they require, at least in the beginning. So helpful, and my go-to place for my advocacy here in Canada. And yes, Kim she is our person in Canada she is always here on Fridays with us. Thanks for being here, Kim. And Robin says, you guys are awesome. I have hope and I don't feel alone. And that's what we're here for on Fridays. And anytime we're out there, we want people to know that we're a community. We're all here together. And this other person, you have a very long title for yourself. I had an appointment with a surgeon in October. I messaged the doctor in Taiwan. They said they knew someone in Michigan. It was the same doctor, and they got my October appointment moved to next week. Oh my gosh, congratulations.
Wow.
That's always wonderful. Siobhan, can you share the information about Dr. Tro? Because
yeah. So
at least in the US.
Yeah. So there's a doctor, Dr. Tro, and that's his website as well, drtro.com. So easy to find, TRO. And he does a lot with obesity management and things like that, especially using low carb diets to help manage or reverse obesity. But I was just talking to him today, and it turns out that he's kind of kept up with our work, and he has started diagnosing lipedema, being able to recognize it in his patients. And that diagnosis can be very helpful if people are trying to get certain treatments covered by insurance. Because if you have that diagnosis, then it can open up a lot of options. So that's pretty exciting, especially because he does a lot of telehealth work. So he's actually licensed in 48 states. So he is all over the place. And because he's licensed in those states, it means you don't actually have to go to him to have a physical appointment first. It means that you can actually reach out through his website, get signed up with him if you feel like he's a right fit for you, he kind of fits your vibe, all that, and then start working with him on that front. So that's pretty exciting, because I've seen a lot of people come, they want a diagnosis or they want to work with a doctor on this, but there's not anybody in their area. So another thing to always consider, not just with Tro, but with other people, is looking at people who can do telehealth or remote care, and see if that's available in your area, because there may be options you haven't found yet on that front.
So Michelle asks if we can repeat the website, because it's Dr. Tro Kalajian, and in his website, do you spell out doctor? Is it DOCTOR?
Yes. So let me navigate to it real quick and just make sure.
Okay. So it's and we'll post that.
Yeah, it's DOCTOR, so drtro.com. And then he has all the information about his history, coaching. He also has online coaching groups and support groups and things like that he also does. So he's a really great resource, especially if you're interested in low carb. He's been doing the low carb thing for quite a long time, and he has a lot of great people working with him as well.
And I can tell you, I met him at Keto Fest, and it was wonderful. I was kind of all fangirling over him. I probably shouldn't have been, but Dr. Tro and Brian Lenskis, is that how you pronounce it? Leskis?
Yes,
Lenskis, yeah.
And they do Low Carb MD, the podcast Low Carb MD, and so I've been listening to them for years, and so it was really amazing that I met him. But it's awesome that he's going to be diagnosing, working with diagnosis of lipedema. That's absolutely fabulous. I'm so happy to hear that.
We have someone,
and I hope. I hope to hear more and more doctors being like, oh yeah, I can diagnose. Oh, I know exactly what that is. I know exactly how to spot it. Like, I'm looking forward to that being the common answer instead of like something we have to be like, oh, look, there's this one guy in New Jersey.
Exactly. Yes. We have someone who posted, does lipedema run with hypermobile Ehlers-Danlos. Sorry, for some reason that word doesn't want to come out of my mouth. So yes, absolutely. Gail, do you have any comments on that?
Well, I get a lot of people ask me that question, first of all. And I have known several that say I got a, what they call it, EDS,
yeah,
EDS diagnosis. I hear a lot about that. I personally, even though I do have lipedema, I am stiff as a board, so it doesn't happen to me. But I know somebody here who's very hypermobile, and she was showing this one.
This is skin hyperextensibility and then also hypermobility.
Right. And she was showing us her compression just a few minutes ago. She can wrap her leg around her head, right?
That is not what I did. I can do that, but that's not what I did.
But it's, and like Kim says, it also runs comorbidity with Derkham's.
Yeah, and also interestingly, this other person said that she thinks she has Marfan's, but I think it's EDS. Because you're correct, Marfan's is also a connective tissue disorder, and there is a genetic testing you can do. Can say definitively if you have Marfan's. So I don't think that there is something for EDS, but you can do genetic testing to rule out Marfan's. But
from
I think you have more on this.
Yeah. So for one, hypermobility does appear to be pretty common in lipedema. One study I came across, it was like 58% of the women with lipedema they studied had hypermobility. And then also the level, like the frequency of hypermobility increased with increasing stage of lipedema. So the people with stage 4 lipolymphedema, it was up around like in the 80% range, which is a lot. And I've also seen some researchers suggest that lipedema may be related to something like EDS or maybe a subset of EDS, but that's definitely not confirmed. It's just one hypothesis of what lipedema is. So yeah, I wouldn't be surprised if a ton of people with lipedema also have an EDS diagnosis. And like you said, Leslyn, with hypermobile EDS, there's not a genetic marker yet. I have heard some stuff that they are working on trying to identify one. There are genetic markers for other types of EDS, but I'm not sure if any that would be related to lipedema necessarily.
Yeah.
So
and
typically you just go off of the diagnostic criteria for now.
Michelle is having difficulty with hearing the website for Dr. Tro, and Michelle, it has been posted both with Facebook and with YouTube, depending on where you're watching. You're on Facebook. It was posted there, drtro.com.
Yeah, and I've put it in also. What I was going to say is we're finding that, some people ask if we call lipedema a fat disorder, but then someone will say, oh, I thought it was a connective tissue disorder. Yes, it seems to be. Oh, I thought it was a lymphatic disorder. Yes, it seems to be. Mm-hmm. So, we're dealing with something that is connected to, it seems like it's connected to so many different things. And so is it a symptom of these things, or is it actually part of it? I mean, there's so many questions right now that are still left unanswered, and we're working like crazy trying to find answers for it.
Yeah, there's a lot of research going into lipedema, and it's very interesting. We're learning a lot. I mean, I say it all the time, but even just looking over the past year of how much research has come out about lipedema, like we're working on it.
Yep. Brenda posts, what type of doctor do we look for in our area that treats lipedema? So, and doctors pretty much do not treat lipedema unless they're a surgeon, and then their treatment would be to perform liposuction surgery. But your doctor is the only one that can diagnose you. So you need a doctor for diagnosis, but if you're looking for treatment, you're going to actually look for a lymphedema therapist that also has training and experience in lipedema, which commonly they do, but not always. And so you'll go to a listing of lymphedema therapists, and then you got to call the ones in your area, make sure that they can treat lipedema. And to find that listing, I would highly suggest that you go to the Lymphatic Education and Research Network website. We can also post that on there. This is lymphaticnetwork.org. And you're going to go on there and look for the provider. What they have is how to find a lymphedema therapist. And they have a bunch of links that have listings of people that have been trained in lymphedema therapy. And so then you would find the one in your area, hopefully several, and then you can call them and make sure that they have the training and experience in lipedema as well. So that's where you would go for treatment. For diagnosis, you have to go to a doctor, and that's why we're talking about someone like Dr. Tro, Dr. Brian Lenskis, who Gail mentioned, he's in San Diego, California. I think does he also do virtual visits as well?
I think he does within the state. I'm not sure if he's licensed in multiple states,
So
but I'll ask, and then I can follow up next Friday on that.
And Dr. Tro is himself in New Jersey, is that correct?
Mm-hmm.
Yeah, so those of you that maybe are close enough, when you go to his website and check him out, you might be able to go to him there. Also, keep in mind that Gail is also our director of our coaching program, and we have a physician who is part of our coaching team, Dr. Carlos Zubaraga, who is in Mexico, and he does see people virtually. So that is someone that you could definitely see for that. But Gail, talk a little bit about our coaching program, because this is very unique. It's coaching specifically for lipedema.
Right. Right now we have a wonderful collaborative of coaches. They come from all over the world. We have coaches in South Africa, Australia, in Mexico, here in the United States. And they coach, many of them coach as keto coaches, or we have nutritionists who are medical nutritionists out of Australia. Some of them focus on aging. Some of them focus on sorry, my brain just went nuts. Like histamines and your particular sensitive reactions toward foods and those sorts of things. We have Dr. Carlos Zumárraga from the Yucatan, and he has studied here in the United States. He's back in Mexico. He has his own clinic, and they are in. He worked with Dr. Westman, and so he's highly trained in the ketogenic way of eating. He works with Timothy Noakes Foundation as a researcher, and he's staying right up to date on lipedema and the way food affects our lipedema. We have 2 CLTs, certified lymphatic therapists, in our coaching collaborative. And the way you get to our coaching collaborative is extraordinarily simple. You go to our website, lipedema-simplified.org, and you go to our coaching tab, and our coaches are right there and available to you. So you can always reach out to them. You can reach out to any one of us here on this call. I don't know what else to say. Our coaches are fabulous. They do some of our teaching. In fact, 2 of our coaches are facilitating the upcoming CSIG with Leslyn. Mm-hmm. And so you're going to have 3 certified lymphatic therapists on that in that CSIG, that coaching group.
Yeah, small correction on my side. Tro is actually in New York, not New Jersey. It's right on the New York-New Jersey border. But he is in that general area.
Okay. It's just been a ton of comments going on with this Facebook Live. Thank you all so much for participating. And sorry that we didn't get to all the stuff. We've already gone over our time, but it seems like there's just so much to say and not enough time to say it. remember too that you can contact us all by email, and especially if there's something you want us to be sure to talk about and discuss on any of these Facebook Lives, let us know. I'm at Leslyn at lipedemaproject.org. And I think Gail and Siobhan, it's both of you, your name at lipedema-simplified.org.
Mine is actually also Lipedema Project. So it's
you're also
Siobhan at lipedemaproject.org.
Yes. Okay.
Yes. Okay.
Perfect.
So it's just my first name, Gail at lipedema-simplified.org. But before we go, I only see 5 people with loves for us. So one of the things that we really want you to do is we want you to hit that heart if you're on Facebook, and let's see how much love we can get from you. And if you are on YouTube, please make sure that you subscribe to our channel to get all the notices, and share this video, share any of our videos. There we go. Now we've got 10 loves. I'm like, come on, girls. Come on, boys. Everybody who loves us, love on us, because we need it. We need that motivation to know that we're loved. I know that's just me, but it's
and thank you all so much for not only being here, but also interacting with us. We like to know that people are actually listening and that you're out there. Thank you so much for being here. And we're here every Friday. Thank you, Angela. We'll be back again next Friday to talk about what's new and coming up with lipedema, and hopefully be able to interact with some of you a bit, to answer some of your questions, have some discussion with you. See you all next time. Bye-bye.
Bye-bye.